Okay, here I go. Hi guys, it's Krista Margolis, nurse practitioner from Southdale OBGYN, here for one of our Let's Talk Menopause Mondays. Hopefully all the tech is right. You know me, it's always a bit of a challenge getting started with the tech piece, but I think we're good. I think I've got Instagram and Facebook working this morning. Wow, it's amazing. So today we are talking about probably one of the I think most important aspects of perimenopause and menopause. And the reason I say that is because it's about sleep, and sleep is everything. If sleep is off, a lot of other things and a lot of other symptoms of perimenopause and menopause can really be exacerbated. So, we're going to spend today talking about kind of a little bit on why the sleep can get disrupted and then also what we can do about it. I would say this is for sure in the top three of complaints I hear from patients on issues they're having as they go through this transition. For sure, sleep, weight gain, and probably hot flashes are the top three, and sleep is really high up there. So to get talking, I do this at every time we have one of these talks. Menopause is defined as once it's been 12 consecutive months without your period, unless it happens surgically or for other reasons. So perimenopause are the years, months, and years leading up to that final period. And that is really the time when a lot of these symptoms are at their peak, is during the transition. A lot of the things we talk about do even out and stabilize once you are on the other side, so to speak. So, on average, about 12% of women, generally speaking, experience some kind of sleep issues. As women age into their mid 40s, late 40s, and 50s, that number increases dramatically to 40 to 45%. Sleep issues become more common and worsen during perimenopause and into menopause and postmenopause. The main reason, there are many reasons that we're going to kind of talk about, but the biggest reason for this is the drop in hormones. A lot of hormones drop, but progesterone and estrogen are our top two that give us the most trouble, I guess I'll say, when we go through menopause, as our ovaries stop producing those two hormones, and pretty much every body system is affected. The sleep issues that most commonly women report, there's a few of them. Number one is hot flashes, meaning women are waking up because of their hot flashes or night sweats. We could call them same thing, just hot flashes at night are night sweats. Insomnia, so just inability to fall asleep or stay asleep. Sleep disordered breathing, and then some other mood and sleep disorders. So we're going to talk about all of those, and we're going to talk about, again, kind of what we can do about them. So first one, hot flashes. Hot flashes are sudden and unexpected sensations of heat all over the body, accompanied usually by sweating. They usually begin in the face and spread kind of to the chest and the rest of the body. They can last for 30 seconds. They can last up to 5 minutes. They affect about 75 to 85% of women around menopause or in perimenopause. They can last for years for some women. Some people report they're not super disruptive. Other women feel like they need to, excuse themselves from a meeting at work or go change their clothes. So like all the symptoms we talk about, they can be minimally disruptive to extremely disruptive. And when they're happening at night, so known as night sweats, they can be incredibly disruptive. I have women report all the time that they wake up and they're laying in a pool of sweat where they have to get up, not just change their clothes, but change their sheets, everything. And what the other thing with the hot flash is because of what the neurotransmitters in our bodies that they're changing, they're energizing. So they increase heat, they increase adrenaline, which if you are familiar with adrenaline, you know that adrenaline gets you amped up, it gets you going. So, you're waking up at 3 a.m, super hot, super sweaty. You got to deal with that piece of it, but then you're all kind of amped up. It's really hard for a lot of people to fall back asleep after they've had a significant night sweat. But even if you do fall back asleep, the sleep is poor quality because those frequent awakenings just make for less quality sleep. So moving on for a minute, we'll talk about insomnia. Insomnia is kind of described as a chronic difficulty in falling or staying asleep that occurs more than 3 nights a week. And this definitely, a lot of perimenopausal women fall into that definition where they haven't prior to this time in their life. They experience restless sleep, miss out on overall quality sleep, and often wake up early and feel really sleepy and tired the next day. And then on top of that, this sleep deprivation can increase feelings of anxiousness and irritability, which for any of you who are already in perimenopause, there's enough irritability to go around for most of us. Can also impair your focus and your memory and increase headaches and inflammation. So none of this is super fun or positive. 1 in 7 adults will suffer from chronic insomnia, but for women that number almost doubles. It's about 1 in 4 that experience some form of insomnia. And that risk of insomnia increases into menopause with as many as 61% of menopausal women reporting insomnia symptoms. So when we think about these numbers, there's a good reason to be talking about this and figuring out how we can kind of help each other out through this transition. Another menopause-related sleep disorder is sleep-disordered breathing. So snoring and sleep apnea are much more common and severe in menopausal women. Obstructive sleep apnea, otherwise known as OSA, is a sleep disorder that is characterized by temporary pauses in breathing, which then lead to kind of gasping, snoring, choking sounds, along with much poorer sleep quality. OSA occurs in about 2% of women, but once perimenopause begins, a woman's risk increases about 4% with each year. So if you think about that, if she's in perimenopause for 7 years, that's a large increase in her chance of developing obstructive sleep apnea. And a lot of research has been done lately suggesting that lower progesterone levels may contribute to the development of sleep apnea. And for anyone who's heard me speak before on menopause and perimenopause, progesterone is the first thing to change in our bodies. It's the first hormone to start decreasing. And it can happen a long time before any real significant symptoms, noticeable symptoms are there. But it's happening. The progesterone levels are dropping. So as that's happening, if you hear my dog bark, just ignore it. So what progesterone can do is that the effect progesterone has, it can help relax the upper airways, which causes the lapses in breathing associated with OSA. So as that progesterone drops, the breathing changes. And what they've also found in studying this is that women who are on hormone replacement therapy, which we're going to talk about shortly, meaning estrogen and progesterone therapy, they're less likely to have any kind of obstructive sleep apnea than women who are not. So we know that taking of the hormones is beneficial for sleep issues, for sure. And then moving on from that sleep disordered breathing to kind of other mood and sleep disorders. Other sleep disorders that can develop during perimenopause include restless leg syndrome and periodic limb movement disorder. Both of these disorders are associated with involuntary leg movements that cause uncomfortable sensations and they disrupt sleep. And then in terms of mood disorders, a lot of menopausal sleep complaints are often accompanied by depression and anxiety. So it's a little bit of a chicken and an egg. Women who are, suffering from depression and or anxiety, which by the way, happens more frequently in perimenopause. But any woman who's already experiencing depression or anxiety has a harder time getting quality sleep. We're going to talk more about that, about why. But then on the same token, a lack of sleep can cause or contribute to anxiety and depression. So you've got a bit of a vicious cycle happening. All right, so moving on here. And not that anyone who is suffering from sleep issues doesn't already know this, but women, when we don't get sufficient sleep, we not only become tired and irritable, but we're more accident prone, exhibit decreased concentration, decreased efficiency, and decreased work motivation. I 100% agree with that. I don't have horrible sleep issues, but from time to time I have some sleep issues, and it totally changes the pattern of my day. I have to work really hard to stay focused, to eat right, to exercise, on those if I haven't had great quality sleep. Inadequate sleep can cause errors in judgment. It can also cause stress hormones to rise, and that is not something that any of us need at all. Perimenopausal women, men, no matter what, we don't need an increase in our stress hormones, especially right now in the world we live in. It's just, there's enough stress to go around. And if those stress hormones stay on the rise, which I've talked about this many times in other talks, it can completely disrupt our overall hormone imbalance and depress the immune system. So then you move into a whole other category of issues when that happens for a long time. And too little sleep over time can put you at greater risk for obesity, heart disease, and diabetes. So again, quality sleep, or at least improving poor sleep, can be a really, really positive step in your overall health. Sleep is also critical for the consolidation of learning and memory, meaning that during our sleep at night, our body and our brains are able to kind of absorb and categorize the things that we learned and that happened during the day. So studies have shown that a nightly battle with insomnia has led to some memory loss, dementia, and possibly even contributed to Alzheimer's disease, and possibly some other brain disorders also. So I'm guessing if you're watching this, it's because you either have sleep issues or you want to learn about it. So you don't need to, we don't need to make this fear-based on all the reasons that you must get a good night's sleep. But just good to know that working on quality sleep is important and really necessary. Okay, so let me just see where I'm at here. Okay. Let's see. Oh, another thing. The brain chemicals that are important for sleep undergo changes. So making our bodies become less efficient at falling asleep and staying asleep anyways at this age. It's just as age happens, sleep changes a little bit. So that sleep that is associated with the release of human growth hormone and memory consolidation, that kind of sleep that is really essential for feeling rested in the morning, is typically decreased with age. And then the one other thing to mention with kind of the why of our inadequate or worse sleep at this stage is feelings. There's a lot of women at midlife that are experiencing kind of increased emotional demands. So you might be becoming an empty nester. You might have aging parents, stress with kids, job changes. There are a lot of things at this age that put an increased demand on our emotional strain. And on top of that, as I mentioned a few minutes ago, a lot of times our capacity for dealing with that emotional strain is just a little decreased. We have a little more anxiety, a little more depression. It all kind of comes together, and the management of some of that emotional stress can become a little bit more challenging for people. So a lot of again, reasons to get or try to get some good sleep. Okay, so if we move on to, all right, that's all good and well, what can we do about it? There's a lot of stuff, and the probably the biggest challenge with with sleep is what works for some people doesn't always work for others. But I think you have to be really mindful about what you think it is that's causing your sleep disorders. First and foremost, is there stress to be addressed? Is there an unaddressed or something going on big in your life that needs your attention? Because until that's addressed, sleep's probably not going to improve. No matter how many supplements or pills you take, you need to address that stress, that underlying thing. Beyond that, there are a lot of tips that we can give, and I'm going to try to kind of break them down. Some of them may be new to some of you. Some of them might be repeat on what you've heard, but hopefully we can make it so that you can think about things in a kind of a full spectrum. It's not just, oh, this one thing. There are many different categories to think of when we think about our sleep. All right, so let's see. Kind of under just general things when you think about your sleep. So they're big picture, but they're also kind of general. One is maintaining a healthy weight, which again, it's some people will laugh when they hear that. They're like, well, I'm in perimenopause, I'm gaining weight. So I know that sounds like a little bit of a, what's the word, an oxymoron, but really working on maintaining your weight. And that is something that, again, we do a lot of in the clinic. I have a nutritionist that I refer a lot of patients to who work with hormonal weight gain. They work on how women are eating. We'll just go right there to that. Eating a diet, along with maintaining a healthy weight, eating a low glycemic diet. And there's more and more and more that we're learning about this, and more that's coming out, and more that I'm learning in my practice with patients on how poorly we have been eating as a society, which I have always known, but how it's affecting us as our cells age. So without it becoming a talk on diabetes, really thinking about high quality protein. We need more protein as women. I can't stress that enough. Less refined carbohydrates. So walking away from the chips and the cookies and the crackers and those things that live in our pantry, and moving to more whole foods, more protein, and balancing out our blood sugar. You know, when we eat those things, the blood sugar goes up, and then we crash, and it goes up, and we crash. This over time is what causes our cells to become tired and more resistant to our insulin that's trying to help scoop up all that extra glucose and extra blood sugar in our bodies. And over time, our body kind of is like, oh, you know, I can't do it anymore. So we all kind of become not diabetic, but this kind of state of high blood sugar. And when that is happening, you're also going to have higher cortisol levels at night, which make for increased that amped up feeling I was talking about, and much harder to go to sleep. You know, we want our cortisol levels in this sweet spot of nice and low at night so that we drift off into sleep. As we wake in the morning, our cortisol levels should be the highest they're going to be. So, okay, I'm ready for the day. And when we're kind of under constant stress, and when our diet is such that we are really, really giving ourselves a lot of refined products and sugars, and that blood sugar is not maintained, those are going to be two challenging things for our cortisol. So thinking about weight, diet, just as an overall piece to sleep is really important. And then another kind of under the general category is regular exercise. We know this. We know exercise is important, but I will never stop saying it, sorry, just had a little glitch here. Okay. I will never stop saying that because it's so important. It is ultimately so important. And we're going to talk about kind of when and how to exercise a little bit in terms of sleep, but just regular exercise is one of the top things. So maintaining a healthy weight, regular exercise, a low glycemic diet. The other thing I would put under kind of the general sleep category or general helpful tips for sleep would be a good quality multivitamin and multimineral. Not everyone in healthcare agrees with this. I do. I think it's really important for women to, if you're not eating perfect, then we can be missing things. And I think a quality multivitamin, multimineral is really, really important. And then probably the last thing under kind of just general category is a good quality mattress. Seems kind of like a no-brainer, but a lot of people will realize that they're waking up in the middle of the night a little achy or stiff or whatever, and once they get a different mattress or get like a sleep number, something like that, they definitely notice it impacts their sleep in a positive way. So let's move on to other things to kind of think of in terms of just getting quality sleep. Okay, so if we think about if we think about our like stimulants and things to avoid in order to get good sleep, you want to really think about avoiding alcohol within 3 hours of bedtime, avoiding caffeine or any kind of caffeine, anything with caffeine after 2 p.m. If you're really sensitive to caffeine, I would say after noon, after 12 o'clock. And that's, coffee, sodas, a lot of teas, chocolate, espresso, any of that stuff. Think about, if there's caffeine in it. Avoiding Sudafed or other decongestant cold medicines. They kind of up that level of stimulant also. There could be medications that have a stimulating effect. So check if you're on any prescription medications and you're struggling with sleep. Talk to your doctor, who prescribed them. Could these possibly be having an effect on sleep? A lot of medications do. So make sure you know about that, or call your pharmacist. They will know also. And then thinking about not exercising. So we just talked about exercise, but not exercising after 6 p.m. If you're, a normal nighttime sleeper. This all changes if you have a night shift job. You can kind of reverse everything I'm saying, but you want to not do a lot of aerobic exercise, like a nice yoga session at bedtime, great. But anything that kind of gets your heart rate up and gets you going is not, you don't want to do that within about 3 hours of bedtime. So we say 6 p.m. I mean, it might be 7 p.m., but thinking about that is very important. And then I'm just looking to make sure I didn't, yeah. Okay. And then nighttime tension and anxiety. So thinking about ways to be calm as we go into our sleep, our hours of rest. Sometimes just having the mindset of, oh yeah, everything from this day is now, it's like closing the book. It's done. Now I'm moving into this phase of rest and regeneration for my brain and my body. And I'm sometimes the worst at this. I will, once my kids are settled or whatever, I grab my phone and I start looking at the next day and thinking about it. I can say with 2,000% certainty, it affects my sleep. Like maybe not where I notice, but many times if I go to bed with task-oriented thoughts in my head and that feeling, I might not sleep as well. So avoid anxiety-provoking activities close to bedtime, meaning maybe organizing, scheduling, work emails, anything like that. Even if it feels like you're like, oh, I'll sleep better maybe if I get these things checked off my list, be mindful about what that looks like. Because sometimes getting that planning, strategic, scheduling brain going, it starts, kind of like a hamster wheel, and it's hard to turn that off. So sometimes I'll ask myself, should I do this right now at 10:30 at night in my bed? Or is probably turning off my phone and doing it in the morning smarter? I think the answer is always going to be the latter. And again, I don't always do that, but ask yourself that. Avoid watching the news before bed. My God, especially right now. There's rarely anything super positive to come from watching it. If you feel like you need to be informed, again, the headlines are there first thing in the morning. Avoid reading super stimulating stuff, before materials in your bed. Avoid paying bills before you go to bed. Avoid doing anything like financial, looking at your credit card statement or anything like that before bedtime. Avoid arguments before bedtime. This is one I've had a lot of conversations with patients about. Going to bed irritated with someone usually ends up being your partner if you have one, because they're right there. And try to find resolution. Try to take 10 deep breaths, find a way to at least resolve it enough to table it so that that's not what's, again, feeding you as you go into sleep, which is supposed to be the time of restoration and rebuilding and doing all the things that we talked about at the beginning. So trying to find a moment of peace with this person that you may be having an argument with. Avoid repeated negative judgments about the fact that you're unable to sleep. So, in other words, if you're going on night 3 and you're like, oh, I need a good night's sleep tonight, I haven't slept well the last 2 nights, and you sit there and say like, God, it's so annoying. Why can't I sleep? Why can't I sleep? Everyone else sleeps. I need to sleep. Not helpful. Just never going to be helpful at all. So instead, kind of reframing it to kind of positive self-talk phrases. I can fall asleep. I am X number of years old. I know how to sleep. I've been sleeping. I can sleep. I can relax. And one thing that I have found also to be super helpful is we all have heard, writing in a journal. We know it's helpful. But in addition to writing maybe quick in a journal, there are some really good pre-formed journals out there where, like, at the end of the day, you write down 3 things that you're grateful for, gratitude journals. Sometimes just that practice, but also just having something next to your bed. A blank piece of paper, a pencil, just have it there. Because if you are awake at 4 a.m. and you're like, oh yeah, I got to do that. I have to remember that. Your brain's going to keep holding on to that and telling you, don't forget to do that in the morning or tomorrow. Just roll over. You barely even have to open your eyes. Jot it down. Studies show that taking it from inside our crazy place in our head and putting it on a piece of paper makes a huge difference, because we know that we've assigned it to another place, not our head. We've assigned it to another location. We're still going to do it. That thing is still going to get done, and it's our job to do it, but we don't have to sit there and think about it on repeat. So keeping a journal next to your bed, I can't recommend that enough. If there is, like I mentioned a little bit ago, something bothering you, if there is an emotional issue, a relationship, something that is definitely troubling you, set aside a time, in the next few days to really take time to think about it, journal on it. Maybe it's a conversation that needs to be had. Maybe it's just saying a few things out loud to a trusted person, whatever it is. Make sure that you're putting time aside to deal with it, because it's not going to go away on its own. Things don't just magically disappear like we'd like them to, until we kind of deal with them. And if there's things going on that you have tried to deal with, or you thought you had, and they're kind of still coming back, it might be time, if you aren't already, to see a therapist, to talk to someone about ways to deal with and move on from some of those things that trouble us. And then obviously Another way to like that nighttime tension reduction is, all the things we know about, some nighttime yoga, restorative yoga poses. If you can just Google it and find 3 restorative yoga poses to do. My favorite is legs up the wall. So if this is the wall and like this is my butt, you're just lying there with your butt up against the wall and your legs go up the wall. It's been proven to restore and relax, and it's a great thing to do before bed if you wake up in the middle of the night. Also, there are, relaxing, meditations, music, just listening to something. There are tons of mindfulness apps that you can have on your phone, even though you're not supposed to have your phone next to you in bed, to listen to, or a CD if you still have a CD player. That dates me. But any of those relaxing rituals and just getting your mind away from whatever it's spinning with. Reading a book, reading a book is a great way to not think about all the things that you might be thinking about or that are causing you stress. Go into someone else's story. Go read, a good fiction novel that's totally someone else's not true story, and get out of your own head. And then kind of moving into more of a like sleep planning and preparation. I've had people say that it's helpful to plan your sleep by putting it into your schedule. And this, probably makes some people cringe, including me, because I have a very hard time with not flying by the seat of my pants. I don't like to be super scheduled, but I know that it's important. So some people will literally put in their calendar bed, sleep, at 9:30 or whatever. And they even have an alarm set or a reminder. So they're like, oh, yep, it's telling me I've got to go to bed. And there are apps that do this too. And it just tells them, yep, you know what? Get off your phone, get off Instagram, stop doing whatever you're doing, go get yourself ready for bed. And then they do that. So it's a good way to start getting yourself into a habit. Ideally, it'd be great to plan for 8.5 to 9 hours in bed. Doesn't mean you have to be sleeping the whole time, but maybe be in bed, at that 8.5, 9 hour mark, and then go from there. And as much as possible, going to bed at the same time every day. This is hard. I know we all have different days that lead to different things and different nights, but as much as possible, going to bed and waking up around the same time every day can be super helpful. Helps to train that biological clock. Begin prepping for bed a good 30 minutes before getting into bed. So, and I fall into this the wrong way sometimes. I'll find myself in bed, dinking around on my phone or doing whatever, and then I'm like, oh, I still got to wash my face and brush my teeth. Try to do those things first so that by the time you're in your bed, it's time to shut down. It's time to wind down, do these things we've been talking about, and go to sleep. Trying to avoid late afternoon or evening naps, even though we get so tired. A quick, 15 or 20-minute nap midday, if your schedule allows, fine. But anything after 3, 4 p.m. can be a little more detrimental to our sleep. And like I mentioned with the exercise earlier, same thing goes with eating. Avoiding, especially a large meal, for 3 hours before going to bed. Ideally not eating anything for up to 3 hours before going to bed. But if you're going to eat anything, as mentioned a little bit ago, make sure there's maybe a little protein, and it's more of like a snack size of something. Avoid drinking more than 4 to 8 ounces of fluid before going to bed. Taking a nice hot aromatherapy bath before bed can be really helpful. Some people will say don't take a hot bath if you're struggling with hot flashes, but I think that when we go in and warm our core temperature, get ourselves ready for bed, by the time we're sleeping, it's not going to induce a hot flash, but if you're in the middle of a hot flash, sure, a hot bath can exacerbate it. But getting our core body temperature up before sleep actually helps to induce sleep. So it kind of depends on what your biggest struggles are, if that's a good idea or not. And a nice hot Epsom salt bath with good magnesium can be helpful also for bed. maybe some essential oils. Again, these are all things you know, but trying to put them all together. And then strategies to use when you have trouble falling asleep or staying asleep. One of the biggest ones, and I have tried to put this into practice, if I do wake up in the middle of the night, don't look at your phone. If your phone is next to you or somewhere close by, pretend it's not. Don't look at what time it is, because then you start in the game of, oh, okay, if I fall back asleep in the next 20 minutes, I'll still get X number of hours of sleep. But then you look at it again 20 minutes later and you're like, oh, I'm still not asleep. Okay, if I fall asleep now, it makes for you're going to keep looking at the phone. So just challenge yourself to not even look. Just don't do it. Try to lie there, breathe peacefully, lull yourself back to sleep. If more than 20 to 30 minutes go by, you might want to switch it up a little bit. Maybe go try legs up the wall or a restorative pose to just change your positioning a little. Maybe you do get out your book that's next to your bed, turn on a soft light, and read for 15 minutes. Something to get, again, your brain away from the fact that I'm not sleeping. So that can be helpful. If you are using a tablet or a phone for reading, make sure that they're in the nighttime setting and that the brightness is set to a super low setting. One of my things that helped, when I first started noticing a little bit of sleep stuff, was using an eye mask. Everyone makes fun of me when I'm, traveling or camping or something with a friend. They're like, oh, there she goes. It is beyond helpful. I love it. I mean, it kind of makes you feel cocoon-like, and mine has a little elastic thing around the back. They sell really good ones at REI. But it helps with any of those, just lights that might come from outside, or a light from whatever it is. Once I put that on at night, I'm like, I'm done. That's it. I think it makes a huge difference. And so, okay, moving on from eye masks to thinking about our environment around us. It matters. Light, noise, temperature, your environment. So again, thinking about lighting, either an eye mask or making sure all the lights are off, dim. Sometimes you have something plugged in that ends up blinking. Just trying to avoid any of that. Let's see, dark windows, window blinds. But some people will argue against that. They're like, no, I don't like sleeping with blinds because I want the natural light to wake me up in the morning. Fine. If you're not having major issues with waking up in the middle of the night and getting back to sleep, I think that's a perfectly fair thing to have. A lot of people use this Hatch alarm clock that kind of starts to light up as the sun would be coming up. I haven't used one, but I've heard great things about it. Noise canceling. So sound machines, a fan. If you are a lighter sleeper or really, again, say waking from the night sweats and need it to be a conducive environment noise-wise, thinking about, earplugs, closing your windows. I never found earplugs to work, but we have a fan that goes in our room. I don't need it. Like if I'm traveling and I don't have it, totally fine. But it does help with any kind of street noise, or it really helps particularly with, when you share a bed with someone, their noises. I love my husband, but the noises can get kind of irritating if you are awake in the middle of the night. Thinking about any external noises, ticking clocks, anything like that. If you're noticing it, get rid of it. Make a change. Temperature is huge. Yes, we want our core temperature warm, but the environment around us can be nice and cool, particularly if you're having night sweats. To wake up like I said, I've had a lot of patients that waking up in literally a pool of sweat. You want to be able to have that environment around you cool you off. And then we live in Minnesota, so it gets cold. A lot of people love their electric blankets. I love them too. But instead of sleeping with it on you, turn it on while you're prepping for bed so that when you get into bed, it's nice and warm. And then turn it off before you fall asleep so that it's not on you, heating you all night. Again, especially if you're noticing night sweats, because that's going to for sure exacerbate that. Okay, so let's move on to kind of what a lot of people I think want to know about is supplements. Like what can I take? What can I, what can I do? I am not, I am zero judgment on people taking sleeping pills or not. If you are in desperate need of a good night's sleep, you need to do whatever you can do to get a good night's sleep. And if that means, I have patients who will, like, I'll prescribe them, 10 Ambien, and they use it sparingly. They use it here and there when they haven't slept in 4 nights straight. 100%. I mean, we know we've talked a lot today about what can happen if we're consistently not getting good sleep. So all of that, is worth a conversation with your provider if you feel you need that. If it's more just a little kind of boost of things, there are some really good supplements that can be helpful. We've all heard about melatonin. I think melatonin is great. I think plain and simple, I think it works for a lot of people. I think it doesn't work for a lot of people. So anywhere from 1 to 5 milligrams, or to fall asleep, or you can use a 5 to 20 milligram time release capsule. You just have to kind of play with it and see if it works and how it works for you. Melatonin is a hormone that is produced at nighttime as our body recognizes it's time to sleep. But like we said earlier, if your hormones are all out of whack, your melatonin production can also become out of whack. So playing with that. One of my favorites for sleep is 5-HTP. And I have I don't think we'll have time to get to it, but I have a whole thing on talking about it. It's been studied. There are scientific studies showing the benefits, usually about 100 to 200 milligrams an hour before bedtime. You can go get it at the co-op. I can guide you to good quality supplements. But it's a precursor basically to melatonin, and it also increases our serotonin levels. Serotonin is our happy brain chemical. Serotonin is decreased in perimenopause because it's directly influenced by estrogen. Estrogen is dropping, as we talked about earlier. So again, it's this kind of cumulative effect. Estrogen and progesterone are dropping. That is then affecting a whole bunch of other things. So 5-HTP is one of my faves. I think it is really helpful, and it kind of can kill 2 birds with 1 stone if you're struggling with a little anxiety or depression, but not to the point where you're like, I need an antidepressant, or maybe you do, but maybe this is just a little bonus. The 5-HTP can be very helpful. Taurine is another one. It's Taurine. I don't have as much experience with this. Again, you kind of, sometimes when you're in healthcare, get used to the things that you get used to, and it's what you end up talking to your patients about. But I will say, I know plenty of people who have tried it and who have found success with it. Another, for me, everyone should be taking, whether you're having sleep issues or not, is magnesium. It's hard to get enough magnesium in our diets, and it's a really, really, really important mineral. Kind of goes back to why I think every woman should take a multivitamin, multimineral supplement, quality one. And a multimineral will have some magnesium in it. But I tell most of my patients to take a magnesium supplement before bed. It also helps if you have any issues with constipation. So anywhere from like 200 to 400 milligrams before bed is a typical dose. You can take more. It is not going to hurt you. You're just going to have diarrhea. So there's that. But it's a helpful supplement for sure. And remember how a little while ago we talked about cortisol levels at nighttime, how we need them nice and low in order to get restful sleep. If you're in a time of high stress, another well-studied supplement is ashwagandha. A lot of evidence around ashwagandha and acupuncture for stress management. Not for this conversation, but things to think about. But that is another recommended. A lot of people kind of do ashwagandha or 5-HTP. They both have really good qualities. And again, I didn't say this at the beginning, but if you have specific questions about any of this, you can throw it, on a comment on Instagram, or reach out to me at KB Margolis, DM me. I'm happy to answer any questions. So in terms of supplements, those are the kind of the ones I would recommend most for sleep in and of itself. Black cohosh is, again, another studied, pretty well tolerated supplement that helps with the helps with the low estrogen piece, so can help decrease our hot flashes. Soy products also, tofu, soybeans, soy milk, they contain what's called phytoestrogen. So basically, plant-based estrogens. They behave like estrogen, they kind of look like estrogen. They go in and sort of fill that estrogen receptor like estrogen does, not exactly, but they mimic it enough that we can get some relief from some of those. There's a lot of people who love to make soy really controversial. And again, if you're someone who needs to be avoiding estrogen, kind of at not at all costs, but at cost because you have a significant personal or family history of stroke, blood clots, breast cancer, then have that conversation with your provider. Maybe a lot of soy isn't the route you should be taking, but I still think that having some is okay. Flaxseed is another phytoestrogen. Just put it in everything, and doesn't carry the same risk that the soy products do. So that's kind of the main things that I would recommend in terms of supplements. What we also know to be incredibly helpful with night sweats, sleep, all this, imbalance is hormone replacement therapy. And that basically means taking usually estrogen and progesterone together. If you have an intact uterus, you need both. The progesterone is a protective factor for your uterus. If you don't have your uterus, you only need to take estrogen, but I think progesterone provides a lot of great benefits also. It's not for everyone. Like I said, a lot of women can't take hormone replacement therapy because of their personal health history or a significant family health history. So as I've said in every one of these conversations we've had, if you're interested in hormone replacement therapy, it's a conversation with your provider. It's changed over the years. When I first started practicing, it was a kind of cookie cutter approach. Like, oh, you're approaching menopause? Here are your hormones. It's not like that at all anymore. It's a conversation. It's usually the approach is smallest dose for the shortest time possible. That being said, I have patients who every year I'm like, what do you think? They're like, nope, not going off my hormones. And as long as they understand the risks and the benefits, okay. So it's a conversation for sure to have with your provider, but they can definitely work and help a lot of these symptoms. Okay, and then I'm just making sure I didn't miss anything in terms of, no, and the other one that it can be really helpful is progesterone cream. Progesterone is a really good sleep aid. If anyone has been pregnant, that first trimester of pregnancy when you're like, oh, so tired and you can sleep nonstop, that is thanks to progesterone. Progesterone it makes everything kind of sluggish and slower, which is also why women get constipated in early pregnancy. But 2% USP progesterone cream, you can find it online, you can find it at co-ops, can be really helpful. And I just learned this tip. Usually you avoid breasts themselves, but usually it's arms, legs. You can rub it on your abdomen. I just learned 2 weeks ago that a significant improvement in women who are taking progesterone cream, putting it on their wrists was really helpful because the skin is so much thinner, so the absorption's a little better. So just a little tidbit. But progesterone binds to our GABA receptors and has a very calming effect. So another thing to consider. I think that covers all the kind of supplements and things you can do. Yeah, a couple other little things I didn't say earlier when thinking about our bedtime routines. And I can attest to this one. Tidying up, which meaning I don't mean like scouring your house head to top to bottom, but a lot of times like having the things in your environment kind of cleaned up helps us relax and go into a nice a better sleep. So just again, something to think about. I think we kind of covered all the other things. Turning off our electronics, practicing mindfulness, which we talked about. And then I think one of the last things that I'll mention, even though it's probably one of the biggest things, I think for brain fog, for sleep, for calm, for stress management, is getting outside. So being out in nature. I mean, in an ideal world, really getting in nature. I mean, like go live in a tent for a few days, but that's not realistic. But as we grow older, not only because of all the things we've talked about, the reasons with perimenopause and menopause does our sleep change, but our circadian rhythms change also. And one of the best ways to keep our circadian rhythms balanced and working as we know them to work is to spend time in nature. Light is the primary external influence on our circadian rhythms. And if you think about a lot of us, most people during the day have limited outdoor light exposure, and then we come inside at night and it's a bunch of artificial light. You know, it's not the way our brains and our bodies want to kind of move in terms of those rhythms. So spending more time outside, and I tell patients this all the time. Yes, even in January when it's only light for, you know, a few hours a day, it seems like, even in those dark times of winter, being outside in what the natural light has to offer. So any moment outside, a 5-minute walk around the block, you know, if you're at work and you're at a desk, if you can get outside for 10 minutes at lunch just to get that natural light, and then certainly at nighttime, you know, if you take your dog for a walk or whatever it is, if you can get out, it makes a difference, for sure. And then another way to kind of think about balancing our circadian rhythm is to change your schedule. So if you're really off on your sleep and you want to make gradual changes to your sleep schedule to get things back in rhythm, you can help do that. So if your current pattern is going to bed at midnight, try going to bed about 15 or 30 minutes earlier each week till you get to your desired bedtime. After a month or so, you will kind of have reset that clock a little bit. It does work, and can be helpful. And then the last thing, and this one's hard, but to kind of reset your circadian rhythm is doing a sleep deprivation challenge. So what that means is like, basically, like if you've ever been on an overnight flight or if you've kind of been unable to sleep, and when you've reached your destination, you've basically been awake for 24 hours or whatever, that's kind of a sleep deprivation. So they do it in clinical settings as part of a kind of depression treatment. But you simply would stay awake for 24 hours and then go to sleep at your regular time the following day. And it can help kind of reset things. So that's just an extra tidbit on the circadian rhythms. Okay, so I think we have covered, I mean, there's a lot. Like I said at the outset, there's a lot of information on sleep. If you just joined, go back and watch this. It will be on replay on, where will it be on replay? On our website, selfdelobgyn.com. You can find all of these talks. And reach out to me with sleep questions. It's a big one, and there's a lot to consider but know that there are ways to make it better, for sure. And most women, when I see a woman who's no longer in the transition, you know, she is done, she is full on in menopause, most of these symptoms, the night sweats, the totally disrupted sleep, everything balances out a little bit. A lot, I should say, not a little bit. Things definitely get better. Women ask me that all the time. Is it better on the other side? I'm like, I think so. I'm not there yet, but that's what I've heard. Again, the word transition, it's the hardest part of anything we do in life. Definitely this perimenopausal transition, when everything is shifting and changing, we're kind of like white knuckling it sometimes. That's where this can be the most challenging. So reach out with questions. Myself and all of the providers at Self-Del OBGYN are here and able to help you with all of this. And that's it. Thanks so much for joining.